How long are you fasting patients prior to emergency department procedural sedation and analgesia in order to prevent vomiting and aspiration? The recommendation for a mandatory fasting period is derived from the anesthesia world, but what happens in the operating room is very different than what happens in the emergency department. We're not using inhaled anesthetics, which can cause nausea, and we're not manipulating the airway, which can cause a gag. The impact of these differences has been well borne out in the literature. In fact, ACEP published a policy update back in 2018 stating, the literature does not support a significant association between fasting and incidence of adverse events in adult or pediatric patients. The urgency of the procedure dictates the necessity of providing sedation without delay regardless of fasting status. There are some things to consider taking into account, particularly in the patient with a truly full stomach. Number one, is the procedure truly an emergency, or can there be some delay? Number two, consider giving the patient an antiemetic prior to that procedural sedation. And number three, consider using a sedative agent that preserves airway reflexes. Finally, there's some emerging data that the GLP-1 inhibitors like Ozempic slow gastric emptying time and might increase the risk of aspiration. Overall, fasting isn't necessary prior to the vast majority of emergency department procedural sedation and analgesia. And remember, the immediacy of the procedure dictates whether we wait or proceed immediately.